Hello, everyone, and welcome to the webcast. My name is Christine Dorsey Davis. I'm the Executive Director of the Ohio chapter of the American Planning Association, and I am your webcast moderator. Today is Wednesday, November 3rd, and we will hear the presentation, Leading with Equity, a more effective way to frame age-friendly approaches. For technical help during today's webcast, you can type your questions in the questions box located in the GoToWebinar tool panel. For your content questions related to the presentation, again, just type those in the questions box. We will answer those at the end of the presentation during the Q&A. And I'll ask that if your question is for a particular panelist, it would help me out if you could list who it is that you want to answer the question. Coming up next on your screen is a list of our APA sponsors, chapters, and divisions. Thanks for those that sponsor us and make these webcasts possible and free to members. Today, in particular, we are sponsored by the APA Private Practice Division, so thanks to you all for bringing this group together in our yearly meetup. We appreciate you and for joining us today. Coming up next is a list of our upcoming sessions. You can register for these and all of our upcoming sessions by heading over to ohioplanning.org/planningwebcast. We are booked through the end of this year, and we are booking some Wednesdays and Thursdays. We're also starting to take sessions already for 2022. We're actually booked all the way through January, where February is filling up. So be sure to check back regularly on our website so that you can register for these and upcoming sessions. Today's session has been approved for 1.5 CM credits for live viewing. You can record these credits by heading over to planning.org, log into your My APA account, and from there you can either search by today's title or event number, both of which can be found on our webcast website, ohioplanning.org/planningwebcast. If you are on social media, be sure to like us on Facebook. That's where I post any important information such as date or time changes. I also send out weekly reminders on Facebook about our upcoming session. And we record all of our sessions and we post them on our YouTube channel. So be sure to subscribe to us so that you get notified when I post new sessions. We have well over 350 sessions up on our YouTube channel already. So be sure to take a look. That is the end of my housekeeping items. So I am now going to turn it over to Ramona Malahi, who is with the Private Practice Division, and she will introduce herself and kick things off and introduce our panelists and all of that jazz. So Ramona, the controls are yours.
Thank you, Christine.
Perfect.
Good morning, everybody, and thank you. And welcome to the Private Practice Division, Leading with Equity. The COVID-19 pandemic exposed inequities and disparities in our country. In this session, we will explore how we can deliver better outcomes for all from existing programs and resources by intentionally centering equity in the ecosystem of public investments. How do we make that difference, and what is the mindset and practical applications? The first approach to leading with equity is the whole family or two-generation approach to family well-being to replace poverty with opportunity. When I think of the safety net of public transfer programs, this slide distills its essence. People fearing losing benefits because of a raise in income, or work promotion, or program closure. And for the experts and people working in the public system, they have a deep but siloed view of the problem, because the benefit system itself is a complicated maze of different thresholds, limitations, unclear rules, varying state by state, county by county, and city by city.
Ramona, could you just click right directly into your presentation? Your little GoToWebinar is stuck on. Perfect. Thank you, dear.
Okay, thank you. The whole family approach or the 2-gen approach, embraces equity through a family-centered lens, building family well-being by lifting children and parents in their lives together. For example, by aligning siloed health and human service programs directed separately to the child, such as the early childhood development, or to the parents, such as workforce programs, to seamlessly work for the entire family, will help parents and children to pursue goals and thrive, unlock new possibilities, and have a greater impact on the public dollars being spent. There are 5 core areas for helping families to thrive: social capital, early childhood education and K-12, economic assets, health and well-being, and of course, post-secondary and employment pathways. Since 2010, ASEN, which is at the Aspen Institute, has served as the policy advocator and national innovation hub for the diversity of 2-gen approaches that are being advanced in 50 states, DC, and Puerto Rico. In June 2021, ASEN released its summary of the state of the field, the community of practice, including stories, accomplishments, insights, and recommendations for action. Hawaii is one of 12 states that have refined more responsive and better integrated service delivery. Ohana Nui, meaning extended family in Hawaiian, is Hawaii's multi-generational, multicultural whole family approach to delivering human services. As a footnote, Hawaii is first in the nation in the number of multicultural families. The whole family approach, Ohana Nui, covers keiki, children, parents, kupuna, seniors, persons with disabilities. It is administered by the Hawaii State Department of Human Services, and it translates human services to human potential. The social determinants of health are the drivers of the family well-being Ohana Nui framework: housing, food and nutrition, health and wellness, education and economic stability, and social capital. More than 42% of children are served by DHS's federally funded programs: SNAP, TANF, child care subsidies, Medicaid, and state-funded programs such as Preschool Open Doors. To ensure the department's internal transformation is sustainable, the Ohana Nui approach is now the law in Hawaii, enabled by the governor in 2019. Intentional transformation of the Department of Human Services' internal culture has taken some critical steps to adapting to Ohana Nui. First of all, recognizing and appreciating the institutional culture takes time. DHS leadership work with supervisory staff to translate large strategic goals to workable daily activities, invest in professional development, create a tier of leaders of change, institute on-the-ground engineers called internal champions, develop pilot projects to nurture the partnerships externally needed with service providers, nonprofits, CBOs to provide more wraparound services. And finally, especially in this context, modernize IT systems and stream their business processes. Some of the lessons gleaned from the pandemic center around leadership, flexibility, partnerships. Accommodating staff is key, and maintaining that flexibility and acknowledging the family, home, life needs that employees and the challenges and adjustments that they confronted. The transition to remote digital platforms was swift, and due to the ongoing organizational change managing and the activities in IT modernization and working of the integrated service delivery, this helped to be seamless and smooth the process. And finally, partnerships were key. Federal waivers were pursued, and therefore DHS was able to maintain the revenue of contracted service providers and that outreach, even if programs are closed. Staff work with providers to modify the scope of services to adjust to the COVID-19 mitigation requirements. Who does the American Rescue Plan help? American families. We are definitely at an inflection point. The American Rescue Plan offers an opportunity to expand real opportunities for all families. We can make a difference. How do we meet the moment? Let's not simply pour more resources in the way that we have always done things. Think boldly. Our strategies to produce better outcomes and well-being for all children and families must be bold. Take a whole government approach to drive results and achieve long-term sustainability. Consider important transformational projects that can make a lasting, positive difference in your communities. Think big. APA has a great resource with its recently approved Planning for Equity Policy Guide. It's a tremendous resource that offers an equity lens on cross-cutting topics and areas of planning. And in addition, there's other 25 policy guides that are also extremely useful. Let me now do a handoff to our next speakers. Mildred Warner will be talking about equity across generations. Laura Keyes will be talking about financing cross-generational services across the life cycle. And we'll end with our closer, Jana Lynott, who will talk about equitable transportation. Let me now turn to Mildred, and Mildred can take it away. Thank you, Mildred.
Thank you, Ramona. There. Can you see my screen? Yes?
Looks good.
Great. Okay. So I want to talk about equity across generations and give particular emphasis to how we can collaborate across generations and address both rural and urban issues. First, I'll give a land acknowledgement. I'm coming to you from Cornell University, which is located in the traditional homelands of the Guayacono people. And we recognize the history of dispossession because the Guayacono predate Cornell and the establishment of New York and of the United States itself. And we acknowledge the painful history and acknowledge the ongoing connection to the Guayacono people. When I think about multi-generational work, this is a way to build equity across generations. So while we have an aging society, we can also be paying attention to the needs of children and families with children. And by taking a multi-generational approach, we can look at the particular design needs faced by children and seniors and look for commonalities and ways we might be able to address them together. We can also look at services and see if there are ways that we can promote sharing services together rather than services separate. And this can hopefully lead us to common vision. Now, the equity challenges, as a society, we invest a lot more public resources in seniors than we do in children. Think of a basketball for seniors and a tennis ball for children. But when we look inside that, we see that the tennis ball for children is primarily state and local funding, and that is mostly public schools. If you look in the chart to the right, you see the red line shows that most of our expenditures on children are basically public school expenditures. But as planners, we need to think about what we can do in early childhood, that's 0 to 5, and then what we can do in later periods of life. For the black line on the chart to the right is federal expenditures, which you see increase after age 65 with Medicare and Social Security, whereas for local governments, the red line, they really increase after age 75, and here we're talking about issues like paratransit. Now, if we're going to take a full life cycle approach, we can think of an average capacity curve, which is lower as you're born and get older, you get more independence. And it's also lower at the older end of life as you begin to lose some of your independence. And we can increase the functionality and the independence of both children and seniors if we pay more attention to inclusive design. But that can only take you so far. And so where inclusive design can't meet the needs for full functioning in society, you need to make up for it with service provision. Whether this is a school bus for kids or paratransit for seniors. This helps to lift us up to full capacity in an enabling environment. Now, when we look at both UNICEF and the World Health Organization's initiatives on child-friendly cities or age-friendly cities, you see that they have many elements in common. Many are focused on design and services, and they're also focused on issues of participation and respect. Those are the ones in blue, and those are really, really important. AARP took the WHO, the World Health Organization's domains, and created a livability index for every zip code in the country. And what we did is we took these values for every county in the country, all 3,100, and we looked at how the different domains relate to health. So we have opportunity, we have housing, the built environment of the neighborhood, transportation, environment, and engagement. And we're looking at how these might affect health. And what we see in this spider graphic is that rural, the green, and the darker purple, the rural core, rank lowest on health, on transportation, and on built environment at the neighborhood level. And so what can we do about that? Well, we did a national survey in 2019 of all cities and counties, and we asked city managers, does your community have at least 50% of its community have access to neighborhood schools, or a sidewalk system connecting residents and services, or public gathering spaces, or a playground within a half mile of every resident, or a mix of services and fresh food markets? And what you see is that these features that are considered to be age-friendly features are more common in urban environments, less common in suburban environments, and least common in rural environments. So this is what leads us to the challenge as planners is what do we do in suburban and rural places? Well, one thing you can do is you can change your zoning codes so that future development would at least be built in a more age-friendly way. But when we look at how many communities have at least half of their community where the zoning mandates sidewalk systems, you see only in urban areas do you see this for about 75% of respondents. But for rural communities, less than 30% say that they mandate sidewalk systems in more than 50% of their community. Similarly, issues of street connections, parks and recreation's a little bit more common, pedestrian-friendly guidelines. Where you begin to see less difference between metro, suburban, and rural is in allowing childcare centers, allowing accessory dwelling units. These are areas where we're starting to see more equalization of how we look at these issues in zoning across the metro, suburban, and rural landscapes. But you still see where under 50% of communities say that these zoning codes cover at least half of their community. But if we go back to that radial chart from the AARP livability indicators, one thing we notice is that while rural communities lag on health, transportation, and built environment at the neighborhood level, they lead on engagement. And maybe there could be an insight there for us as planners. So if we go back to that chart that I gave you at the beginning, looking at a capacity curve, and thinking about the importance of inclusive design, of formal service provision, we can add another layer called networks and engagement. And this is the piece that I think we need to give a lot more attention to as planners if we want to build full capacity in an enabling environment for all children, working age adults, and seniors. So I want to give you an example from Tompkins County, New York, which created an age-friendly Center for Excellence. And what's interesting about this task force is that they decided early on to move away from the old age focus of most age-friendly work and make an all-age focus that included both children and seniors. The task force had broad representation from community agencies, and we conducted a study of the local comprehensive plans and zoning for all 16 municipalities in the county. We also looked at service access. We did a case study on the COVID-19 response, which very similar to Ramona, address the issues of leadership, flexibility, and partnerships, and we saw the importance of cross-agency collaboration. So the community, the first thing the task force did is said we need a framework for this work. So we looked at UNICEF and WHO and AARP's framework, and we came up with this flower framework that puts issues of land use, housing, neighborhood, built environment, open space, recreation in one set of the flower. And then we said, but equally important are services, transportation, childcare, healthcare, education. And then there's also this community piece, which is not just civic and social engagement, but also what information mechanisms do you have? How do you build respect, inclusion, and trust? And don't forget the business sector and work opportunities. But at the center of this flower is cross-agency collaboration, and we argue that's a missing domain in the WHO framework. So the county plan has smart growth and nodal development as its primary focus. And the idea is that with increased housing density, you could create more opportunities to build age-friendly attributes into the physical planning. And in some of the rural areas, there's hamlets and villages, which could be a place where you might integrate land use and services. And you see on this map, the pink in the middle, that's the city of Ithaca. And then all the dots are outlying rural hamlets and villages. Some of them are barely more than an intersection, and a couple of them, like Dryden and Trumansburg on the two ends of the map, are actually communities that have more services. And so what we decided to do is to look particularly at senior housing. And so what you see on this map is the purple dots are market rate senior housing, and the red dots are subsidized senior housing. And then the black circles are a radius, a buffer around a place that has a pharmacy or a grocery store. And what you see is that in the center of the county, where we have the city of Ithaca, you have pharmacies and grocery stores, and you have market rate senior housing. And so they have accessible access to critical services such as food and drugs. But in the outlying communities where there's been an excellent effort to build subsidized senior housing, there is not access to grocery stores and pharmacies, except in the 3 towns at the northern part of the map. And so part of what has happened here is that while this subsidized housing might have been built 20, 30 years ago when these communities still had a pharmacy and a grocery store, with consolidation, those stores have closed down. Now, you see the blue lines are the transit lines, and the transit does a good job of connecting these senior housing facilities to services. But the problem is the timing and the frequency of the routes is all designed for commuters. 1 bus in the morning, 1 bus in the afternoon. And we did a survey of the bus stops, and most of them do not have seats and do not have shelters. So realistically, they don't work for seniors to ride. And so this raised the issue for the task force that we need to promote delivery services of pharmacy and groceries, and COVID made this even more clear. And so one of the recommendations was that we needed to add economic developers to our age-friendly task force. So that brings us back to this importance of cross-agency collaboration at the very center of our framework. And I'm going to tell you 2 quick little examples of how that worked. During COVID, we had a real issue with access to food and drugs. And so the Tompkins County Office for the Aging came together with our food pantry system, the Food Bank of the Southern Tier, and our Meals on Wheels delivery system for seniors, and the school districts, and Gadabout, which is our paratransit agency. And what we had here was broad community collaboration. And we use the paratransit buses and the school buses to deliver food to seniors and children, rather than delivering seniors and children to those services. So it was showing that kind of flexibility that Ramona has talked about. A second example is the role of schools, fire halls, and libraries. In our surveys and in our interviews with community leaders, they kept coming up as being very, very important institutions, especially for rural communities that may not have other types of social service agencies present. These are the places where people come together for programming. And as one interview said, you know, libraries, we're yes organizations. When you come to us with a need or a problem, we say yes, and we figure out how to make it happen. These are also places that help build trust and a sense of communication and information sharing. When we did our national survey, we asked about which agencies in your community are engaged in cross-agency partnerships for service delivery for children and elders. And no surprise, libraries, schools, and parks and recreation departments top the list. They are partners for planners, and we should be thinking about how we might work with them. What is disappointing is if you look down toward the bottom of the chart, you'll see that planning departments and transportation and highway departments are the least likely to collaborate in cross-agency partnerships for service delivery. So there, my friends, is our challenge as planners. How do we reach out to new kinds of partners if we really want to address intergenerational equity in our plans? I'll end with a slide on resources. We've done all of these are open access, and you can access them to see what's happened with the surveys, because we did a survey in 2013 and again in 19. The second one is the story on the COVID response. And the other two are open access journal articles looking at the results of the survey on healthy places for children and how to address age-friendly planning across the rural and urban divide. And with that, I will turn it over to Laura.
Hi, Christy. Is my screen showing?
Everything looks good.
Great. All right. Well, I'm excited to kind of share some tools that planners can utilize within their municipality or nonprofit to be able to build a case for the type of collaboration that that Mildred is talking about with the work that we did in a case study with this city of San Antonio. So get started with, age-friendly community initiatives are comprehensive. That's what we've learned in all of this work discussed so far across these 8 domains of age-friendly, calling for collective input and action from many partners, including our governments, our nonprofits, our residents, the general public. But there is a specific role for the municipality in this planning effort. They're the closest governing body to the people, but they also have a legal obligation for zoning, housing, building our infrastructure and our neighborhood development that directly affect whether individuals can remain in their community as their needs change. In many cases, the local governments sign on to age-friendly resolutions or initiatives, but the leadership and the policy action are relegated to local departments of aging services or senior services. So the focus of this talk is to talk about how local governments can leverage senior center investments, or the senior services can lead on how to leverage these investments to capture the value of public amenities and to move towards horizontal collaboration within their municipality and move programming for older adults and then intergenerational programming beyond the walls of the senior center. The research for this presentation focuses on a case study with the city of San Antonio pre-COVID. The city health services department was interested in learning how to leverage and collaborate across other municipal departments that could also have a responsibility, or do have a responsibility, for age-friendly, for supporting their age-friendly resolution, such as the planning department, transportation, the library system, the parks and recreation department, and their health department. These findings help us learn something about service demand, the interest of the services and the utilization of services among our older adults within the senior center system, to help us understand how we may connect and collaborate and capture the value of these services through other public amenities that we provide. The older adults, the senior center programming occurs through both 10 municipal comprehensive centers and 8 specialized centers. So our survey responses came from 846 members of the senior center community. We identified service usage across the senior centers themselves, and our findings showed that the top 4 services utilized by older adults with older members included the meal program, games, exercise and recreation, and health services. When we compare between the senior center types, the comprehensive center and the specialized center, we found that there was underusage and duplication of the services between both center types. This led us to consider how this information can inform opportunities to grow participation, to grow our membership, to reach more individuals within the community while reducing overlap and inefficiencies from the duplication of services. So for instance, if you look at the library services, we see that there's both duplication of services between centers, but also underusage. The same goes for our findings relative to the exercise programmings. Now, it's important to recognize that some older adults are going to prefer having access to these services within the center themselves, but it also shows an opportunity where we could be better utilizing and coordinating with our library system, for instance, or with our parks and recreation department on the types of programming that we're offering to the broader community. It may also provide opportunities for us to expand services in areas of the community that are under-serviced at the moment, so to eliminate some disparities in that type of programming. And I'm going to show in a moment how we help kind of turn this survey finding into a mapping product for the community so they could identify these opportunities for market potential and utilization, creating utilization efficiencies. We also found, as part of our survey research, we found that we were able to categorize members into 3 different types of users based on their preferences and their grouping by service demand within their preferences for programming. We also found opportunities that the opportunity for older people to be friends with others and to socialize was associated with their participation patterns in activities, some activities over others. This included participation in multi-person activities, as well as health screenings, art programming, and exercise classes. These findings tell us that socialization opportunities are very important to the decision-making patterns of older people participating in senior center programming. Knowing this can inform program decision and program design to increase participation in these activities at the center, but also in how we want to design and build partnership programming with our other public amenities within the community. So we were able to then also help visualize the survey findings through mapping them through ESRI Storyboard. And what we're seeing here is really directly related to the survey findings that show the preferences and service demand for computer usage. So this is just one example of all the different types of programming offered at the center. So what the darker shading represents is the number of survey respondents using a senior center within a 5-mile radius as a percentage of the total 60+ population in that area. The map's purpose is to illustrate the service utilization among older people in the area of the senior center itself. So the darker census blocks show the top 20% of amenity use relative to other census block groups within the community. And so what we're looking at specifically are the senior center locations organized by green circles and red circles. And these have meaning as well. The green circle means that the service is available. So at these locations, at these senior center locations, computer service programs and education programs are available. The larger circles demonstrate or illustrate a greater market potential based on the survey results, so based on the demand that we measured. The red circles show that the amenity is not available. So the dots here represent computer classes, as I mentioned. And what we can see if we look at the southern part of the city, if you look down on the slide, that the larger red circles mean that the service is not available, but there is greater market potential to provide that service in the community. This mapping helps identify also, where we have service inequalities as they relate to the demand and availability of that service in the community. We also created their own Attractiveness Index, is what we called it, which was basically an algorithm that we created that identifies sort of the locations within the community that are age-friendly. So we utilized the 8 domains, but also relied heavily on the literature for just the geographic variables that would help support what it means to be age-friendly, and then as well as available data that showed a spatial relationship. So what this Attractiveness Index does, as I mentioned, it identifies locations in the city that are deficient or rich and age-friendly. So the darker the area, you would identify as those areas that are rich in age-friendly features. So the index purpose is to suggest an optimal location for future senior center locations or other public amenities for that matter, based on the presence or the availability of the age-friendly features. So the purpose is to optimize our public value of these investments that we're making. So the darker areas show more attractive based on better availability of access to parks, transportation, medical facilities, doctor locations. We even have fewer toxic sites based on EPA data, better housing options across price point and size, as well as access to other public services within the community. But what this mapping also shows us is that there are areas outside the map that are potentially showing underserved places that are deficient of age-friendly features that are not lacking or even emerging as age-friendly places. So it also then kind of shows us on the reverse places that provide opportunities for us to then begin working on our age-friendly policy implementation. So the survey findings and the maps are important to understanding opportunities for service utilization and service optimization through the public amenities that we're already investing in or have invested in. Our findings suggest opportunities to eliminate duplication of services, combine senior center services, or even collaborate with other municipal services and amenities in the community. With the goal to increase access to programs through our other public partners, or even for that matter, our nonprofit partners, and also provides us the opportunity, for instance, to enhance multi-generational programming, for instance, with our parks and recreation programming. But there are practical implications for our city managers and our planning departments. Age-friendly policy implementation spans across the work programs of most municipal departments. And this requires proactive opportunities or finding opportunities to collaborate and also breaking down silos that may exist, for instance, in our dedicated budgets and in our expertise that is associated with those particular departments. This opportunity using survey work and mapping work allow us to apply the age-friendly planning lens to other departmental plans, other departmental work programs, with the intent to capture the value of these public amenities that can help support older adults, but all individuals within our communities as their needs change. So thank you very much. And I'm going to share this now with Jana.
Okay. Well, good afternoon. And Christine, can you see my screen okay?
Yes, everything looks good.
All right, wonderful. Well, I want to use this opportunity to talk a bit about leading with equity from a transportation and public space design perspective. And I am trying to figure out, Christine, how do I make this box go away from my screen? I think I've got it.
We don't,
all right,
okay,
I've got it.
I was going to say, we don't see the box. So is it,
Okay.
did you minimize it okay?
Yeah, I think so.
Okay. Okay, great.
All right. So as Ramona mentioned earlier, COVID, along with the deaths of George Floyd and many other Black Americans at the hand of law enforcement or public vigilantes, has resulted in a racial and social justice reckoning across America. And this has been very painful for our nation, and yet it gives me hope. And I say hope because I think the events of the past couple of years have really helped to elevate previously marginalized voices in urban planning. And that has led to important conversations happening that were not happening at nearly the scale that they are today. And it's helping us reach broader audiences to help make our communities more equitable. So for my presentation, I've really kind of taken a step back. And as I have been joining in on these conversations and learning from others who are working in this space, I thought I would use an opportunity here to share some of what has really stood out for me and has been helpful to help me understand my work as well and put it into a new perspective. So I want to start with a definition of equity, which I think, as we all know, it's a term that can be loaded and it means different things to different people. So I want to just share PolicyLink's definition, PolicyLink being a national research and action institute that advances racial and economic equity. And this is their definition: a just and fair inclusion into a society in which all can participate, prosper, and reach their full potential. And it helps unlock the promise of a nation by unleashing the promise in all of us. And while much of our nation's conversation has been on the racial and economic aspects of equity, it's really important to include within this definition the opportunity for all of us to engage fully in the civic, social, and economic life of our communities. AARP's Livable Communities work focuses on those essential features of community that allow residents of all ages, abilities, and backgrounds to thrive. And these elements include physical, the social, and the institutional. Now, Angela Glover Blackwell, who is the former CEO and now founder and resident of PolicyLink, published The Curb Cut Effect in 2017, which asserts that an investment in one group can cascade out and up and be a substantial investment in the broader well-being of the nation. And I really get a kick out of this illustration of the curb cut effect, where a wheelchair user asks the school maintenance worker if he could please shovel the ramp. And the shoveler's response is, well, all these other kids are waiting to use the stairs. When I get through shoveling them off, then I will clear the ramp for you. And the simple response is, but if you shovel the ramp, we can all get in. And this is just, for me, great imagery for both the curb cut effect and also what we talk about in terms of universal design. Now, Angela's article goes on to describe how a group of disability activists in Berkeley, California in the early 70s got fed up with the lack of mobility for people with disabilities and engaged in some tactical urbanism, where overnight they poured concrete curb ramps so they could better get around. It was a political statement with very tangible effects. These disability activists, they really pressed the city, which installed the first official curb cut in 1972, and it would become the slab of concrete heard around the world, as it really helped our country and even other countries think differently about access and opportunity. Hundreds of more curb cuts followed, then thousands. And in 1990, President George H.W. Bush signed the landmark Americans for Disabilities Act. Well, curb cuts and other ADA mandated and inspired changes to the built environment have benefited not only people with disabilities, really everyone, older adults, moms and dads pushing strollers, workers pushing heavy carts, business travelers wheeling luggage, youth on skateboards. So this notion of the curb cut effect is salient today as our nation confronts both an aging population and the anguish of rising inequality. Now, transportation equity is influenced by many factors, and how we experience our transportation system in our public space really can differ by our race, our gender, and our physical or cognitive ability, whether we have any type of mobility limitations. It's also influenced by our income, where we live, when we travel, and how we travel. But it's also influenced by our transportation investment decisions as a society. And for the past 60 years, our communities have favored personal motor vehicle travel as the principal form of transportation. And that is a problem when fully 1/3 of residents of the United States do not drive. And this includes 1 in 5 people over the age of 65, many individuals with disabilities, many low-income residents who cannot afford the maintenance of a personal vehicle, and children who are too young to drive, and simply others by choice. So the way we've made our investments has really left many behind by our current transportation system. And thus the plans and investment choices that we as transportation planners have a great deal of influence over have a major impact on the equity for these individuals. So how might we revamp our transportation and public space investments so they support more equitable outcomes? Well, I recommend that we start with this equity and justice framework for assessing public infrastructure. This is not my framework. This was put forward by Setha Lowe of the Public Space Research Group at the City University of New York, and it's based on 20 years of ethnographic research on parks, plazas, and streets, and it builds upon social justice planning theory. But I find this framework very helpful because it breaks equity and justice down into 5 dimensions with 5 questions that we can ask ourselves as we go about our work. So it includes distributive justice, procedural justice, interactional justice, representational justice, and care. And I'll go into a little bit about each of those. So distributive justice requires asking oneself, who has access to the street, the park, the trail, the vehicle, the app, etc.? And the focus here is on the fairness of the outcomes achieved. People with mobility limitations that require them to use a wheelchair or other mobility device are intimately familiar with the failings of our built environment. So in this photograph, it's not clear whether this is a road that divides 2 unique jurisdictions, where one jurisdiction has built their sidewalks and curb cuts up to ADA standards, and the other one has not gotten to that point yet, even though the ADA has been in place since 1990. But this individual needs to navigate the entire system, and those jurisdictional boundaries are really meaningless. And so the poor design of the physical infrastructure really puts a barrier on individuals' ability to get around their communities, also it decreases the safety of their travel. But even when the sidewalk design meets ADA requirements, the use that the environment by others how others use that environment can also infringe upon the use by others in the community. So I take the example of dockless bikes and scooters, which has resulted in many older adults being very wary of the public realm, where they fear they may be crashed into, or more likely, they may trip over one of these vehicles that's left strewn across the sidewalk. Another example of a lack of distributive justice is that most parents, and particularly those in communities of color, do not feel it's safe for their children to bike in their neighborhoods. So in getting at this notion of distributive justice, we need to ask ourselves, do all neighborhoods in the community have equal access to parks, trails, bike lanes, sidewalks, slow streets, bus lines, etc.? And better yet, just as Mildred has shown, map those differences and share it with the community in order to deepen community conversations. And sorry, Laura, I meant to say Laura. Now, procedural justice focuses on the means used to achieve the outcomes. Who has influence over the design, operations, and programming? And one of the core competencies of planners is the design and execution of public engagement processes. And there's lots of resources out there about how to go about doing this. Certainly, the first question we should ask ourselves at any public meeting is who is represented at this table, who else needs to be at the table. I think many of us have experienced less than ideal participation, even after making an effort to draw in more voices. And there are many factors at play. What is the history that a community has with government? Do people trust government? Do people believe they can influence the outcome if they show up and put in the effort? Does the process overwhelm them or bore them? Transportation planning processes are complex, they're multi-year, they've got lots of rules for local, federal, state funding streams. You've got the constrained long-range plan, the transportation improvement plans. It's a real insider's game that can take years to master, even for the professional transportation planner. So how do we create processes that engage people who don't have that kind of time? Are there meaningful ways for the single mom with 2 jobs who relies on public transportation to have her voice heard? Or must she show up monthly for a 2-hour meeting to make a difference? So it really takes a lot of creativity and effort to draw diverse groups of people in, and lots of engagement in the community to build those relationships. But even before you get to a public meeting, and certainly before a plan is finalized, it's worthwhile to do an internal assessment and ask, who will most benefit from the proposed policy investment? Who is the least likely to benefit? Who is harmed? And who has benefited in the past? Now, the third element of equity and justice framework is interactional justice. What makes people feel welcome or unwanted in public space? And this image really speaks to me about how our physical space surrounding so many of our bus stops sends the message, we don't care about you. From not providing a shelter along a busy highway to making riders walk through the mud on a rainy day. But it's certainly not only the lack of physical infrastructure that makes people feel like second-class citizens. Policing practices can have the same effect of making Black people feel unwelcome or unsafe in public spaces, in part because African Americans experience 2.5 times the likelihood of being killed by law enforcement compared with whites. They are also 63% more likely to be subjected to a traffic stop, even though as a whole they drive 16% less than white people. Driving, walking, jogging, biking while Black is very much a thing, and it creates a psychological barrier to accessing and enjoying the public realm. And closely tied to interactional justice is representational justice. Representational justice has to do with whether people feel their experience in history is represented. And One of the most teachable moments that I wanted to share with you all is something I experienced in the past couple of years. It started through my participation at an American Public Health Association Disability Section Walk, Move, Audit workshop. And this happened in fall of 2019, long before anyone was even thinking about COVID. And we did some presentations on inclusive design, which was the focus of the workshop. And that was followed by a walk audit led by expert Mark Fenton, who some of you may know and have worked with. And it was a group of people like me attending the conference, along with local disability rights advocates from Philadelphia, where the conference took place. I was paired up with a woman with a visual impairment who used a white cane, and I was excited to be walking through downtown Philadelphia's public spaces with new eyes and gaining new perspective. She helped me notice how scooters parked up against the building prevented her from using the building to navigate with her cane. She also pointed out how there were no navigation cues in the plaza design to help her cut through the plaza. So this plaza space that was so beautiful to my eyes was also uncomfortable for her. Now, when we all got back together to debrief our experience, we came up with lots of examples of how the physical design of the environment impacted access. But in 2019, no one talked about how racism might impact walkability. No one drew attention to this statue of former mayor and police commissioner Frank Rizzo. In fact, I walked right by without even noticing, my eyes busy trying to find the accessible entrance to the plaza deck instead. Fast forward to July 2020. APHA invited us to redesign the workshop as a webinar. And it became clear as we brought the group back together that our workshop on inclusive and accessible environments had missed some really important voices. The previous month, protests had erupted in Philly over this statue, a symbol of oppression and brutality to many of the city's residents. It has since been taken down. So representational justice involves addressing the historical and cultural erasure that takes place in communities across the country. In Philadelphia, the more than 1,500 public statues, there's only one that honors a Black person. So when we as planners are working on creating more accessible environments, our focus is often on that design of the physical infrastructure. You know, are there curb cuts, bike lanes, ample sidewalk spaces, benches at bus stops? But as I learned through this eye-opening experience, we also need to be attuned to the symbolic representations in our public realm and the effect those representations may have on whether people will feel that they belong. So the final element of the equity and justice framework is care. How do people demonstrate care for the space and the people in it? During COVID, I've understood this to be the simple act of putting on a mask in shared public space in order to reduce the spread of germs. But it can also look like a community coming together to pick up litter and beautify their community, to plant community gardens or commission a mural that speaks to local community experience, or even host a block party. During COVID, my own neighbors replaced an annual Easter egg hunt with a painted rock scavenger hunt, which was a huge hit with the local kids. So there are many, many ways for the community to come together to express care for one another. So just to recap, the equity and justice framework includes these 5 elements, and it has really helped me examine my work as a planner and gain new insight, and that's why I wanted to take the time today to share it with you. So thank you.
All right, thank you. If everyone wants to jump back on, we can jump into some Q&A. Folks, if you have questions, like I said, just type them into the chat box in your GoToWebinar tool panel, or the questions box, that is, and we will see if we have time to get to them. I am just going to take some controls back here just so that you can see us all. All right, so the first question that we have, Let's talk about distributive justice for a second. This question just came in, so that's for you, Jana. And you mentioned, for example, like e-scooters, electric bikes, things like that, and how it can deter our older population from wanting to utilize sidewalks out of fear that they would get run over or whatnot. So what is the alternative? What can we do to accommodate our seniors while at the same time keeping up with the trends of our younger population, you know, by offering things like electric bikes?
Yeah, that's an excellent question. It really does get at the heart of, you know, really thinking through the different population groups that are using public space in our communities. And certainly the solution is not to like ban these things. You know, I do think they have great benefits in communities, from providing transportation options to many individuals who are able to use them. They also provide the potential to reduce carbon emissions in our communities by being much less energy intensive. So I think for me that the really important thing is that we address the parking of where these things get placed when users are not using them. And I am a big proponent of the docked systems where users actually pull in like a city bike share and dock a scooter, dock a bike. And it's well-designed space for where things can belong without being in the way. I think as a backup plan, even just the parking corrals on each block where scooter users can go and place them. It's a home that they can congregate, and it's a little more loose for those users. Right now, there are some companies that are testing locking them to something with the hopes that it's getting them out of the pedestrian access zones. I haven't noticed that that's working all that well in my own community. They can still block the pathways and create problems. And so I do think more attention needs to be put to solving this problem.
Any other comments from our other panelists on that before I move
I
on?
think it just highlights the really important need for the horizontal collaboration. If we're working in the you know, through the lens of age-friendly planning or livable communities for all ages, is really making sure that that planners within your community are working with those that are in, for instance, just aging services to understand the, you know, crosswalk times for individuals of a certain age, or the impact of crossing streets with different, you know, individuals experiencing different disabilities, so that it isn't just an assumption that everybody is operating at a same capacity, to understand what those interfaces are going to be like for someone. They can't get out of the way of an oncoming motorized scooter that quickly or something to that effect. So this just highlights the importance of the collaboration.
I'd also like to say that my colleague Nick Klein did a crowdsourced study of scooters and where they get parked, because there was a lot of concern about this. And then they compared it to cars parking illegally, and discovered that the car parking illegally is much more of a problem than the scooters being left in places where they shouldn't be. So I just put that out there. It really changed my view on the issue, because I hadn't put it in the comparison of thinking about cars. But of course, scooters tend to park on sidewalks and cars tend to park illegally on the street. And so that may make more issues particularly for seniors who are walking. But I just put that out there.
What cities was that? Did that study cover?
It covered a lot of cities, because it was a crowdsourced, so people were doing this. Lots of people were upset about it a few years ago, and so lots of people were tracking it and taking pictures of it. And the study is published. Can you park your scooter there? Why? And it's if we had a chat function, I could put it up there for people. But if you look up what can you park your scooter there, you'll get the article.
Can you park your scooter there? I will find it and I will put it in our chat function that all of our attendees can see. And
Christine,
even,
can I add on to that too?
please.
I want to back up on the overall framework that Jana just introduced to us, because its application, I think, is really wide. If you take a, it doesn't necessarily just apply to space, but it can apply to so many different things. And one of the things I want to point out too is, so I'm going to introduce a new Hawaiian word, hui, H-U-I, which is really group, right? So I belong to tons of different groups: agriculture group, finance group, kupuna feeding group, vaccination group, and all that sort of stuff. But I also belong to what's been formulating or emerging as an energy equity group, HUI. And, I find that framework really applicable only because in a group that has both the utility and the customer base, the conversations are kind of more delicate in that, and we also have the PUC, the Public Utility Commission, represented there. So I think that framework really helps you think through and generate some of these discussions over issues that are very crucial in regards to addressing clean energy, renewables, moving from, oil and petroleum, but putting it in a way that is really thoughtful. So I want to comment that I think that framework that John has introduced is extremely valuable in being more nuanced but gentler in the conversation. So it's not like pointing of fingers, but it's really a thoughtful examination, and having all players be able to have those conversations, I think, are crucial at this time. So thank you, Jana.
Sure. Thank you. All right. Next question is, well, first it's going to be a plug, and then I want you all to respond to it. Right here in our backyard here in Ohio, a professor at The Ohio State University, Kyle Ezell, he and Rick Stein created an autism planning and design guideline book for APA. They started an interest group, and it was sort of very eye-opening. They had various groups come together on various levels on the spectrum, and talked to them and figured out what it is that they needed from the community perspective to help them. And I feel like that this is a topic that is just really not talked about. Not that we forget about those with processing issues or concerns or sensitivities. And the same thing, I think, then could also be talked about for those with mental or emotional sensitivities. So how does that all play into what you do? Have you talked about it? Is there space to talk more about these topics or these classes, these groups of people that also need the same amount of help as, those who might be in a wheelchair or, might have hearing or sight issues?
The last time we presented at APA, we had a young man sitting in the front row who was on the autism spectrum, and he was getting his degree in planning at a school in Los Angeles. And he was extremely exercised that we were talking about aging, and we were talking about children, and we weren't talking about autism. And he felt this was a major area that was missing for planning. It was very clear he was going to be a contributor to helping planning get on board with this issue. And it was really quite inspirational to see him engage, and he stayed around afterwards, engaged with us. So I welcome that your colleagues have stepped up to this issue, recognizing how people respond to each other in very different ways. They respond to external stimuli in different ways. And as a society, we need to learn how to embrace everyone. And I think it's going to be a huge issue for employers, for planners, for everyone. So I applaud you bringing this up.
Is there a link to that resource?
Yeah, so it's a PAS memo, I think, and I know he also has a lot of resources just through his stuff. I'll link some stuff up here in the chat box so that you can see more. I believe you have to be logged in as an APA member to view the PAS memo, but all of that information I'll put in here. And there's also essentially there's design guidelines that just really were sort of mind-blowing, and anyone else have any comments or thoughts about that?
So I want to also underline what Mildred said, and thank you for bringing that to consciousness, because that young man was impressive. On our, I'm going to go use a Hawaiian word again, Kapuna vaccination outreach group. So although it started with the seniors, it is large. It's very all encompassing, including representation from people at the table in regards to persons with disabilities, both at the state level and at the customer base level. And I think that kind of cross-fertilization has been extremely valuable now, because just as you just pointed out, it's something that we don't often focus on when we're talking about addressing the needs of all, right? And one thing that this pandemic has really underlined for all of us is everybody needs to be at the table, and at the same time we are educating or self-educating ourselves in regards to really what all really encompasses. So thank you so much for bringing that up, because I think that that's something that I would like to share with our community here. So I look forward to seeing what that link is, or those links that you have, Christine. Thank you.
Of course. And I feel like I had Kyle and Rick on one of my webcasts right when they first released it. I'll see if I can go back and find the recording of that, where they essentially kind of lay out the whole scope of things from start to finish. If I find that video, I'll put it in the link. And frankly, I think we need to have them come back on, and we need to revisit this topic.
And National should have it on their site too.
Oh, it is. It's a PAS report through APA.
PS or memo? Which one?
Oh, I'm sorry. It's a PAS memo. It's a PAS memo.
Okay, perfect.
All right. Okay, next question. Let's talk about broadband. So where do you see the lack of broadband internet service disrupting equity in public investments, and how can we start the conversation, especially in rural and small communities?
There's a real challenge.
Okay, go for it.
Go ahead.
Well, the challenge is that there's a lot of money being poured into right now, right? You see through FCC, NDIA, NTIA. So the focus, in fact, I just was entertaining a conversation yesterday about, gee, why can't we, there's so much money being poured on the rural end. Why can't we have the entire state be rural? And of course, that's kind of crazy, but it's totally, I agree, and I know Mildred will point that out, is that there's a lot of focus right now in terms of increasing that broadband connectivity in the rural areas that's really available. And I think that both in USDA also, and with HRSA, there's more funding that focuses on those needs and accessibility, not only in broadband, but in connectivity to other types of services. Sorry, Mildred.
No, that's okay. But one of the issues is that the economics of rural, there's a reason why it wasn't built in rural in the first place, because the density is not there to make the economics work. And when you do build it, you still have the affordability problem. That people can't afford to subscribe. And so one of the equity concerns is that the legislation has focused on building out in rural where it's needed because it's not built out, but not paying attention to the ability to hook up, which is an affordability problem in both urban and rural communities. And so we have to, if we care about equity, we have to think about not only building out the infrastructure, but allowing people to connect to it. And that's an affordability problem. And that's an ongoing affordability problem. And it's both urban and rural.
And the emergency broadband benefits, EBB, if you take a look at what the FCC does, it tracks and creates a dashboard in regards to the access to devices, the other part of it, right? And also the month-to-month cost of maintaining that kind of connectivity. And I think if you take a look at all the states, there's quite a variability in terms of getting the word out to rural areas or underserved urban areas who really need that type of support. And it's been really interesting. People thought that that money, I don't know, was it 10 billion, would be gone in 6 months. Well, it doesn't look that way, because it's just as it's challenging to connect up with rural areas, it's also challenging to get people to be able to fill those forms. And although FCC has tried to streamline it, that has not always been, you know, it's a constant, it's an emerging, developing activity to be able to make that access available.
So Mildred mentioned our AARP livability index in her presentation. Thanks, Mildred, for the shout out on that. So that's one of the projects that I lead. And within our livability index, we have two indicators. One is looking at the availability of high-speed internet. And then the other on the policy side is we're tracking whether there are any state prohibitions against the formation of community broadband networks. And there's a surprising number of states that have laws on the books that prevent community broadband networks from being passed. So I think, you know, one of the solutions in my mind is that that needs to be addressed so that the public sector can come in and play a role in trying to bring this important infrastructure to more people.
Okay, I did find the video recording, and I posted it in the chat box from the autism and planning session. And the other thing is, we recently, earlier this year, we had a couple webcasts planning for infrastructure resilience, which also touches a lot on the underserved community, and particularly regarding with COVID's children, students being at home and needing internet access and in order to complete schoolwork. And, you know, the world is never going to be the same. Everything is pretty much going to be hybrid from this point forward. So, you know, things need to happen yesterday. Let's see here. Next question. Oh, this is an AARP question. Does AARP ever engage with bike share or scooter share operators? I assume just to open up the conversation about ways in which they can work together to, you know, offer safer accommodations for pedestrians.
I don't know that we've had any formal conversations, but certainly I've had conversations with scooter operators at various conferences and as part of my professional network, and you know, raise these concerns and have some of those conversations. I know that, you know, they are, you know, working on things. If, for instance, in DC, and I think a lot of it comes from a push from the public sector as well, where DC was one of those jurisdictions that said, okay, scooters now need to be tied to something to try to get them out of the pedestrian pathways. But no, I completely agree that it is important to have these conversations, but I don't know that we've done that at this point in time.
So a lot of the considerations that communities need to take into account are, for sure, big picture, long-term, might take years, even decades to implement. For example, everyone having access to parks and trails, you know, that's not something that we can do overnight. It has to be incorporated into, you know, 10 different types of plans. And what can we as communities, as planners, do in the interim to support our aging community, to support folks at all stages of life in the interim, while we're trying to work out some of these issues like access. What is it that we can do to help?
Well, one of the things that we are doing right now, I'm at University of North Texas, and we have a undergraduate degree in urban policy and planning, and our couple of our faculty are working directly with some of the cities to help them advance, kind of build capacity and advance some of their efforts to get, for instance, our students are working directly with one of our neighboring cities to do surveys throughout the community to measure resident feedback on access to parks. So the whole goal is about improving equitable access to parks, and where do they need to focus and direct funding? Well, funding is ongoing all the time. I mean, well, within their budget of parks and recreation, for instance. And so this is helping them gather, on the ground information to then be able to figure out how do they reprogram or target programming to begin to respond to issues. And maybe some of it is longer term, such as, we need parks in these spaces where we have inequalities in park access, and maybe some of it is just, some barriers to being able to access the parks that are there. So how can we respond to those improvements in a more immediate fashion, such as lighting or better, infrastructure improvements around the park itself to improve access, or crosswalk signals, things of that nature that they can respond to in a more immediate fashion, and then gathering data that's going to inform, future park planning in the longer term to where do they have to fill gaps. So there's some things, I guess it's how we look at the approach. I mean, our cities are spending money on infrastructure and decisions all the time, and so it's where do we want to target that funding, and how can we make adjustments based on this new information that we gather from our community. You could utilize CDBG funding for some of these things. So there's resources that are available that could begin to tackle issues now. It's just kind of how do we gather the information and kind of set it into short-term, mid-term, and long-term outcome expectations.
I agree totally with Laura. I think the time now is to position ourselves. We know that not only with ARP or with CARES funding, there's always been funding that's not been spent. I think being informed and being able to position yourself for now and whatever other funding that may pass the legislature, may pass Congress, the next iteration, would be extremely useful. But also I agree that having the opportunity to build that data and that case and taking a look at, let's face it, we're still in this administration, it's still fairly new. And if you take a look at some of those executive orders or White House releases, you can get a tenor in terms of the direction of where the administration is going. And that means that the agencies will have to address that in some way. So for example, equity, all of the federal agencies have had to address with equity and develop their own equity plan. And knowing that the direction is key really allows people at the local communities to start strengthening the existing collaborations and broadening those partnerships to be able to be ready and creating that platform of information, data, partnerships, collaboration that will be really key to be able to access a lot of this funding, because we do know that some of that ARPA funding that's coming to the states and the local governments have not yet been formulated in regards to how some of the communities are going to be able to spend it, number one, and those programs that are being administered to the IRS, not all of the rules, regulations, guidance, or all of that sort of stuff has come out. So I think that we as planners should take a look at how we can utilize all the tools in our toolkit and position our communities to be better able to be responsive and to be able to be recipients of this funding and to help even direct or drive some of this, especially in areas in which at the very core, equity, that the whole equity issue obviously is never going to go away. And so the thing is, how do we lead it? How do we make sure that we're addressing that? And how do we position ourselves to be able to have the kind of robust response funded to be able to make those types of accomplishments?
I can just say we've done a survey of, we had about 500 cities and counties from across the country respond on how they plan to spend their ARPA funds. And those who are focusing it on social equity are the ones who actually have ARPA plans. Most every place wants to do water sewer, but those who are actually focusing on the other things that are allowed by Treasury that have more of an equity lens, it's if they have an ARPA plan. So if your community doesn't have an ARPA plan, help them develop one and put equity in it.
Okay. It's 2:30. We have to wrap up. There are still several questions that we didn't get a chance to get to. So for those attendees, please feel free to reach out to me. If you don't have email addresses, if you do have email addresses for our panelists, feel free to reach out directly to them. Please remember, we are recording this. We'll post it up on our YouTube channel. Don't forget to log those CM credits. We have a lot of great sessions coming up, so be sure to register for those. And I think that's it. Thanks to the Private Practice Division of APA for hosting today, and Ramona for coordinating all of this. We appreciate you. And for our speakers, Jan and Mildred and Laura, thank you. To everyone, have a great day. And some of you, maybe I'll see you on Friday for Friday's webcast. Everyone have a great week. Bye-bye.
Thank you.